Yeah, we are good to go.
Okay. So welcome to those tuning in to Anxiety Canada's Town Hall this week. And thank you for taking time out of your busy day to join us. My name is Mark Antczak, and I'm Anxiety Canada's in-house registered clinical counselor and health educator. And I come with the added background as a private practice clinician that works with anxiety disorders at the Vancouver CBT Centre. Today, I have the privilege of moderating today's town hall, where we'll be talking about the emerging topic of trauma and PTSD and grief on the frontline workers that are experiencing as a result of COVID-19. I'm joined by our two amazing expert panelists. First, we have Dr. Katy Kamkar, clinical psychologist at the Center for Addiction and Mental Health, assistant professor within the Department of Psychiatry at the University of Toronto, and scientific committee member at Anxiety Canada. And we've also got Dr. Carmen McLean, clinical psychologist at the Dissemination and Training Division of the National Center for PTSD at the Palo Alto Veterans Affairs, and a clinical associate professor affiliate at Stanford University, and our lovely scientific committee member at Anxiety Canada. Okay, so we're gonna go ahead and just jump right in. We're talking obviously a lot about the COVID-related PTSD and trauma that a lot of the frontline workers have been facing. So the first question can maybe go to Carmen. So how do we differentiate between first responders and frontline workers, first and foremost? And what are some of the specific things that are causing them heightened anxiety at this time?
Sure. So a first responder is someone with specialized training who is among the first to respond and arrive at the scene of an emergency. So these are EMTs, police officers, firefighters, paramedics. First responders are a type of frontline worker, which is a broader category of people whose job requires that they provide their labor in person. And within this group, there's a really large range of potential exposure to COVID. On the low end of exposure would be people like an electrician, for example, who would mostly be working alone, but might have some occasional exposure to people. Of higher exposure would be our grocery store clerks, who are exposed to a higher volume of people throughout their shift. First responders might see a lower volume of people, but might be more likely to see people who are infected and sick with COVID. And then really at the high end of exposure are the healthcare workers who are experiencing really sustained, repeated exposure to infected and very sick patients. So among that sort of higher exposure group of healthcare workers, I think there are a lot of different stressors they're experiencing right now that would likely cause heightened anxiety. I mean, for one, it depends on the geographic area where they are, because there's certainly areas that are much more harder hit by COVID than others. But in those harder hit areas, I think they're seeing just a huge increase in the volume of patients that they're treating that are very sick. And so, you know, they're working in a very intense, high stress work environment. They're working excessive hours. In many areas, they don't have the supplies and equipment that they need. So they're having to make sort of morally ambiguous decisions about who does or doesn't get access to potentially life-saving resources. In many areas, you know, they're doing all this while basically risking their own health because they don't have access to personal protective equipment. That's not been like in the media as much, but at least in the US, that's still very much an issue in some places. So there's a number of things that are increasing stress. And then the other thing I want to mention is that there's also many of the adaptive coping strategies they might normally use aren't really available because of COVID. So just basic things like getting a pat on the back or a hug from a coworker, going out for a drink with some of your team after a really tough shift, spending time with your friends, spending time with your family. Many healthcare workers are isolating, also isolating from their own families. So not only are they experiencing many stressors, but there's also less access to many of certain kinds of social support that could potentially sort of buffer against that stress.
Yeah, so I imagine, you know, being in such a stressful situation from the get-go, not having the basic personal protections, or even not having access to some of these things that they would typically rely on, like that pat on the back, like the hug, how much harder that would be. I'm curious, Dr. Katy, have you been seeing much of this in the community, or do you have any thoughts on just the particular stresses that frontline workers have been dealing with around COVID?
Yeah, and I think that these are very relevant questions and concerns that we have pretty much witnessed and heard globally, and it's very understandable. We know that even generally speaking, police, first responders, including frontline health workers, generally there is exposure to potentially traumatic events and events really leading to psychological distress and then also moral suffering. Of course, we know with the COVID-19, we hear greatly in terms of fear, sense of isolation, grief, and loss of life. Now, I think that really what's add to it is that in addition to the exposure to almost a series of potentially traumatic events prior to COVID-19 pandemic, you add to that with the COVID-19 pandemic is the context provides it makes it functioning under extreme pressure. So we are talking about, as Carmen mentioned, the fear of contracting the virus, but we also have the fear of spreading the virus, including to the family. So there is also the possible separation for family. There's a concern against, as I mentioned, spreading the virus to the family. There is a mental and physical exhaustion. A lot of concerns around the protective equipments. And once we are afraid to spread the virus to the family and to go home, that also means that we are taking the trauma home. So then home doesn't feel safe anymore, is not safe anymore. And that has led to an additional significant stressor leading to more psychological distress. But we know that, when we talk about moral suffering or moral distress or moral injury, anytime we question, let's say, did I do something right, or maybe I did not do something right, or we question our judgment or our decision making, or action or lack of action that might have transgressed moral beliefs or standards and values, can lead to moral suffering. Certainly here we know in terms of, your good question around loss and grief, well, we know that grieving has changed, or sometimes, we have loved ones who are dying, we're not able to have the physical closeness. And here the frontline health workers or the first responders have had to liaise the communication between the family and the loved ones, or not being able to spend enough time and care with patients. All of those can really lead to more suffering, including also more the added exhaustion and burnout. So I think this is great that we are talking about those, so that we're very much focusing on prevention. What could be some tips and strategies we can use to build our individualized resiliency given the challenging time?
Yeah, and you talked a lot about the buzzwords that we hear a lot in the news media right now. We talk about the moral injury, compassion fatigue, burnout. And I'm curious, Dr. McLean, do you have any thoughts, or if you could even explain what some of these concepts are, in particular from the trauma perspective?
Sure. Yeah, I can I can talk about moral injury and PTSD, because I think those overlap a lot. So moral injury refers to the emotional, psychological, behavioral, sometimes spiritual impact of a morally injurious or morally distressing event. And a morally injurious event is when, usually under really stressful circumstances, you do something or fail to do something or witness something that really transgresses deeply held moral beliefs or values or expectations. So moral injury, the key sort of characteristics of moral injury are feelings of guilt, feelings of shame, and feelings of anger. Guilt being, I did something bad, and shame being, I am bad because of what I did. So those are the key features of moral injury, which is a clinical phenomenon. It's been observed, it's been described in the literature, whereas PTSD is a diagnosable disorder that can develop after a traumatic event. So a traumatic event is something, an experience that involves threatened death or actual or threatened serious injury or sexual violence. A traumatic event and a morally injurious event are sort of overlapping circles. So an event could be one or the other or both. As I said, PTSD is a diagnosable disorder, so it's been codified in our diagnostic manual. There are specific symptoms of PTSD. They fall into 4 different groups. So one is re-experiencing symptoms. This includes unwanted memories and nightmares, avoidance symptoms, so pushing away thoughts and feelings related to the trauma, distracting yourself, not going certain places that remind you of it. The third is changes, negative changes in cognitions and mood. So excessively blaming yourself for what happened, not being able to feel positive emotions. And lastly, hyperarousal symptoms. So this is being really irritable, being jumpy, not being able to focus on things, trouble sleeping. There's a lot of overlap between moral injury and PTSD. The key features of moral injury, guilt, shame, and anger, those are actual symptoms of PTSD. And also, feelings of betrayal, loss of trust, those are also common to both moral injury and PTSD. The distinction between the two is in the types of events that can lead to their development. The fact that moral injury is not a disorder, whereas PTSD is, and PTSD is relatively much more understood. It's been much more studied than moral injury. And also that there are a number of symptoms of PTSD, like hyperarousal symptoms, that are not part of moral injury. Bringing it back to healthcare workers and maybe an example. So if you imagine a healthcare worker who contracts COVID because they don't have adequate personal protective equipment, and they're subsequently hospitalized and intubated, that experience would be considered traumatic, per PTSD criteria. And it could also be a morally injurious experience because, healthcare workers, their role is to do what they can to save their patients. And there's an expectation that they're to be given the resources that they need to do that work and do that work safely. And that expectation is violated in some places right now. That's not happening. And so it's I think, a type of betrayal, a type of institutional betrayal that could lead to moral injury. Another example would be, the healthcare workers that are making decisions or enacting decisions that result in death, and they're being continually exposed to that death. That would also put people at high risk, I think, for developing both moral injury and PTSD. We do know that if you have both, you are more likely to have severe symptoms. You're more likely to have greater impairment in your day-to-day functioning, and to be at higher risk for suicidality as well.
Yeah, and I know we've been hearing a lot about that in the news, especially with the lack of ventilators that were, out in the hospitals and just doctors having to make that difficult decision of who gets to be on one if they don't have enough, right?
Yeah.
So I imagine that it kind of falls in that category that you were speaking to. Yeah. And Dr. Kamkar, you were mentioning a couple of buzzwords as well that I think are worth exploring and mentioning. So things like compassion fatigue, things like burnout. Can you speak to those pieces a little bit, or would you have
Yes,
anything to add on
absolutely,
those?
because these are very relevant. And I agree with what you said, right? Concerns about ventilators and having to make a decision that definitely can increase the risk for moral injury. And the one thing also is that moral injury can be increase the risk for PTSD. So it's absolutely possible not to have PTSD, but then suffer from moral injury. Nevertheless, it does increase the risk for PTSD. Or some people can have moral injury as well as PTSD concurrently. But most prominent emotions that Carmen did identify are very much shame and guilt. So from a case conceptualization, assessment, and treatment perspective, it's very important to address those emotions, because we often talk about fear and anxiety, but the most distressing emotions that really shatter the belief system or our perception of self and our sense of identity and contribute to withdrawing, social isolation, and the feelings of worthlessness are actually shame and guilt. And a lot of times when we have difficulty functioning, whether it could be at work or personal or social, it has to do with those prominent negative emotions. The other thing is also the symptoms of moral injury are very much similar to the symptoms of PTSD. Nevertheless, the mechanisms of action driving the symptoms is different. So in PTSD is often the fear for safety of self and others, versus, let's say, moral injury is the concern around the betrayal of self or others and the shattered belief system. So the mechanism is very different. Another major risk factor is, yes, and thank you for mentioning that, is it's very much compassion fatigue. Now, interestingly, the entire literature on compassion fatigue very much onset with nursing population, and now increasingly the awareness that, yeah, it spreads to in any human service profession, especially when there is care involved, it could increase the risk for compassion fatigue. Now, compassion fatigue is the stress that results from the traumatized individual rather than the trauma in itself. So it is this intense sense of preoccupation or tension that we might develop we associate it with the emotional physiological pain of the ones that we are trying to help, rather than, again, the trauma itself. And very much, again, the symptoms can be very similar to the symptoms of PTSD. Nevertheless, it might not necessarily PTSD, it is the compassion fatigue. And sometimes it could be, again, feeling hypersensitive to any of the information, or sometimes when it's too much for the body to handle it, we can feel numb and suddenly we lose our sensation entirely. We feel that we are now being insensitive and we are now not being caring, which also then we perceive it that, oh, it's a loss of identity again, which then again leads to even further psychological distress. Or again, with compassion fatigue, it could be a lot of self-blame, or it could be dwelling over and over. I should have done this, I could have done that, and so on. So with moral distress and compassion fatigue, and the repeated exposure to trauma and all the stress that we just talked about, of course, it can increase the risk for burnout, which now since last year we have increasingly heard. And so burnout is really this, we know the three main components. So it has to do with the exhaustion. So we might feel emotionally exhausted, psychologically or physically exhausted. And there is also, in addition, and actually the exhaustion is very different, and we need more research to have a better understanding of that. But the exhaustion is different from, let's say, when we feel exhausted, if we might struggle with clinical depression. So the exhaustion is kind of different. It's often marked with insomnia, difficulty to recover. And then there is this apathy or cynicism, or the sense of depersonalization that we call. So, and which actually we can see it as a grief. It's a loss, in that We might lose interest in our activities. There could be a loss of sense of self and our identity. Again, it could be this numbness. It could be because we lose our sense of zest and passion, a love for what we had, and we feel there is now this reduced care involved. There's this increasing cynicism. And then the third one is this negative self-evaluation, this reduced self-efficacy. So for example, a lot of negative self-talk, negative self-labeling, and people start losing their self-confidence. So people, for example, might say, I was doing this for 30 years. I don't see myself as being doing it anymore. So a lot of those features might tap into burnout. So burnout, compassion fatigue, moral suffering are related. They all impact one another, and also increase the risk for PTSD, but they are distinct constructs, and that's important. Like we do know through the latest, most recent systematic review also showed that burnout, stress, anxiety, and depression are distinct constructs. So that's important for us to be mindful and to appreciate in any case conceptualization and any of the planning that we engage in.
Thank you. For those just tuning in, I wanted to give a quick little welcome. Welcome to the town hall on working with PTSD and trauma within the context of COVID. We're joined with Dr. Katy, Kamkar, and Dr. Carmen McLean. And throughout the event, please feel free to submit questions if any come up for you. And also a quick little plug for Anxiety Canada's COVID-related support page. You can find that on anxietycanada.ca's website. So just going off that topic, Dr. Kamkar, you mentioned a lot about grief. Can you talk a little bit about the context of grief and how grief is impacting people within the age of COVID in particular?
Yeah, and it's so important. I think that we can very much associate entire COVID-19 with grief from, let's say, people say, I miss going out and, grabbing my coffee, my newspaper, and going to the office. Or it could be, I miss attending those social events and the gatherings and birthdays. To grief, of course, on the other end, which is dealing with illnesses and the suffering and all the losses. So it very much varies on a continuum. And also grief around loss of, let's say, it could be finances, it could be employment. So a variety of types of grief. Nevertheless, we have also seen that in terms of the loss of loved ones, grieving and the funeral and the mourning, all of those concepts have entirely changed with the pandemic and all the restrictions. So not being at times with loved ones in their final hours, or not even maybe knowing what happened to the loved ones in the final hours, not having the physical closeness with the loved ones, not being able maybe to attend funeral and to mourn in terms of all the gatherings. Those have been drastic changes that everyone has noticed, and people have felt the psychological distress related to that. We know that overall speaking, when it's grief, losing a loved one is the most intense and the traumatic one. Everyone experiences grief differently, but here we know whenever we are not able to get a closure that we need. So for example, in that context, a loved one who passed away and the inability to be with loved one during their final hours or to maintain that physical closeness and so on can, let's say, lead to what we call this ambiguous loss. And ambiguous loss can increase the risk for even what we call complicated grief. So this is more at the other end of the spectrum. So what we call even in DSM-5, complex bereavement disorder and so on. So it really has to do with the prolonged grief. There's a lot of mixed debate in terms of even what we mean by prolonged, but we do know that if there's this persistent chronic sadness, chronic difficulty accepting the loss of loved one, and the inability, chronic difficulty, inability to return to our normal functioning can lead to what we call this complex grief and prolonged grief.
Mm-hmm. Yeah, and Dr. McLean, I'll direct this next question to you. So in particular, you talked a lot about trauma and PTSD. How would someone know whether they are suffering from trauma, or whether they have symptoms of trauma that need to get addressed? And another follow-up question to that is, a lot of workers have very short-term counseling that's covered through their work. So sometimes they'll have as little as 4 or 5 sessions. So one of the questions asked here as well was, what kind of modalities work best for short-term trauma relief as well?
Well, I think that for people that are experiencing trauma, I think first of all, it's important to know that symptoms of post-traumatic stress are common and normal, and that's expected. And for most people in the weeks and months following a period of trauma, those will tend to dissipate and people will recover on their own without any treatment. For some people, of course, that won't happen, and they will tend to have symptoms that persist. So I mean, the symptoms of PTSD I somewhat have described already. So I think people might notice that they're feeling, on edge, they're having trouble sleeping, their mind keeps going back to the trauma and replaying it, they're having nightmares, those kinds of things would be signs. I think there are, in terms of intervention strategies or treatment, there's a number of things kind of depending on the timing of where you are in relation to the trauma and the severity of symptoms. There are, for example, self-management tools that people could try that are mobile mental health apps, like PTSD Coach, for example, is a really good one. It's developed by the National Center for PTSD. Beyond that, there's growing evidence for kind of brief versions of evidence-based treatments that are sometimes implemented kind of outside of specialty mental health clinics, which I think is great because brief treatments tend to have lower dropout associated with them, and they're much more accessible to people if they're delivered, for example, in a primary care setting. If someone does need a full course of an evidence-based treatment, the ones to look for PTSD are prolonged exposure therapy, cognitive processing therapy, and eye movement desensitization reprocessing therapy. People might benefit from a pretty wide variety of different things if they have PTSD, but those three are the ones that have been demonstrated to be effective and efficacious and safe and acceptable and feasible in a really large number of studies. So those are the ones we really have the most confidence in, and those should be considered the first line treatments.
And are those feasible in the limited time that often people have, like the 4 or 5 sessions, or what would you recommend if they do have a more limited time frame for getting treatment?
Are you talking about like through an employee assistance program?
Yeah.
Kind of deal?
Mm-hmm.
Yeah, so no, they're really not. They really couldn't be implemented in that sort of time span, and I would assume that they're largely not accessible through those types of programs, would be my guess. I would assume that those are more typically involving kind of supportive care, supportive therapy, which could be helpful for people. So, if that is what fits best that's what's feasible for them, do that and see how far that takes you. Consider supplementing maybe with some self-management tools. And then I think if you're still struggling at that point, that would be the time to kind of look for alternate treatment.
Thank you.
Those treatments that I've mentioned, the PE, CPT, and EMDR, those can be masked. They can be provided in a shorter period of time if that is more feasible for people. So it doesn't necessarily have to be once weekly sessions over a period of months. It could be daily sessions. It's also variable, how long it will take any given person to recover. So some people will need fewer sessions than other people, just to keep that in mind too.
Mm-hmm. Yeah, because I mean, like with all mental health, it exists on a spectrum, and I imagine depending on the severity of the PTSD itself or what they're facing or how close to the index event that they were, it would require different levels of therapy, I would imagine. Yeah. So next question for Dr. Kamkar. We talked a little bit about grief just a little bit ago. We obviously have a lot of different people who are suffering from grief, grieving a lot of different types of things, whether it's the loss of a loved one, the loss of a routine, loss of a job. I'm curious if you have any recommendations or suggestions as to how people could help process that grief, So in particular, the grief of losing someone and not having access to proper funeral arrangements, and the grief of those who may have lost a job or may have lost their routine in their day-to-day.
Yeah, and I think that, so again, grief is very individualized and depending on the context. So clearly here, in terms of the loss of a loved one, seeking social support, quality support, very important. And we have seen that technology has provided tremendous help in that regard. So anything that people can do to be able to reach out and seek quality support would be very, very helpful, in addition to, of course, maintaining self-care. If they see that over time, the distress and the sadness becomes more prolonged and difficulty initiating activities, difficulty engaging in any type of self-care and maintaining any healthy level of functioning, early intervention is key. So seeking professional help would be very, very helpful. Now going back to the overall COVID-19 pandemic, in terms of the new routine, new structure that has again created a lot of anxiety, but then also a lot of kind of different type of losses. The first thing is always around, we're very much identifying our range of thoughts and our emotions. So that, and yeah, we might feel powerless. We might feel that we are losing control. We might start having negative thoughts about ourselves because we have such a tendency to identify our sense of self and measuring our identity based on our activities. So when our activities change, suddenly this is again, the identity, our role becomes shattered, and that on its own creates fear again. Normalizing those reactions, very important to know. No one is alone. So once actually we're able to share our reactions, we're able to see that, oh, I'm not alone, and we're all going through the same thing almost here. So normalizing the reactions, reaching out for support, using technology. Again, some people, again, I've heard people go out, they maintain their physical distance, and they're still able to say hello to friends or colleagues and loved ones and so on. So a variety of creative ways that people can do. The other thing here also was important for our police and first responders and frontline medical workers, because it's such a protective role all the time, that even when they go home, to learn to also be off for duty as well, because we always want to be in that protective mode. And so to allow time to recharge our batteries and to rest and relax, very important. To catch, again, as I mentioned, our negative self-talk so that we can reduce our tendency to judge ourselves. And as Carmen also mentioned, we have to fit in self-care, especially when the work is so busy and it's high pressure. And, there are certain things that we might think they're obvious and they make sense. Doesn't mean that we are practicing them. So things like, we have to be hydrated, or engaging in stretching exercises in between shift, in between clients and shift work. Actually, when we do stretching exercises, it helps to reduce the muscle tension, the muscle pressure, and we think better, we think more clearly, and it helps to also restore better the emotions. There's also a powerful technique that we often talk about. It's called, and it's part of mindfulness as well. It helps the mindfulness and to be connected to the here and now. It's the sensory grounding. So what do I see? What do I hear? My sense of smell and taste and touch. So using our senses to be grounded. So for example, we walk outside, we want to feel the fresh air touching the face. Do I hear the birds? Or you have your coffee, feel the coffee, feel your food. So sensory grounding along with breathing technique, being more mindful of the breathing. We can slow down the breathing, often helps to for the physical reactions, emotional reactions to lessen, and for us to, bodily speaking, feel more calmer. And here, one of the best protective factor against everything we talked about, the moral suffering, compassion, fatigue, and burnout, is really around self-compassion and compassion satisfaction. So self-compassion, once again, detecting a range of thoughts and emotions so that we can normalize them. It can help to prevent overly identifying with them. So we can reframe the thoughts, so taking an objective stance and reframe the thoughts, putting them into perspective. The second is practicing everyday self-kindness. So appreciating our hard work and how invaluable we are, regardless of the outcome. So very much practicing self-kindness and remembering humanity. Remembering humanity. So yeah, we need to accept imperfection, and there will be mistakes. There will be, so remembering that we all human beings, and that helps to reduce self-isolation, and that will help what we call compassion satisfaction. Compassion satisfaction is the contentment that we derive from our work and the satisfaction that we get from treating our patients. So that also helps to build further a compassion satisfaction.
Thank you. And just as a plug, because grounding exercises can be so impactful when it comes to managing a whole variety of symptoms. And Anxiety Canada's MindShift app actually has a whole section called the Chill Out Zone, where you have pre-recorded grounding exercises that you could fully listen to for free. And for those of you that are just joining in, thank you and welcome to Anxiety Canada's Town Hall. Today we're joined by Dr. Kamkar and Dr. McLean. We're talking about PTSD and trauma that frontline workers are facing in the wake of COVID. We were just talking a little bit about ways that we can kind of support grief and how we can process grief during this time. I'm wondering, Dr. McLean, if you have any suggestions specifically on those individuals who might have lost a loved one to grief during COVID, or what they can do around that, when some of the things that they would want to do, like having a proper burial or not being able to see them in their last hours, they don't have access to that.
Yeah, well, first of all, I would say that my heart really goes out to people that are in that situation, who have someone in the hospital or have lost someone in the hospital. That's a really, really tough situation to not be able to be with them. It's absolutely necessary for safety, and it also robs people of that opportunity to provide comfort and to say goodbye to their loved one in person. And when a loss is, people have a harder time when a loss is sudden, and not being able to see the person in those final days, I think can add to that sense of suddenness. And as Dr. Kamkar said, the sort of ambiguity around it can I think complicate the grief process for people. My suggestions, I think, are going to be similar to Dr. Kamkar. I would say, first of all, keep a routine. That's very important with your sleep and your eating. Do schedule and engage in pleasurable activities, even if they aren't that pleasurable for you right now. Things that you would usually enjoy, do those things, and do keep up basic self-care. So that's eating and sleeping on a regular schedule, exercising, and spending time outdoors. To the degree that you can do those things in your environment, do those things. This kind of basic, schedule and self-care stuff, it can really feel like a chore, but try your best to do those because when that stuff goes by the wayside, things can snowball a little bit, and it can be harder to pull yourself out from that. I think grief has a way of making you feel really lost and just rudderless. And so it's really important. It's really tempting to let that go by the wayside, but it's really important to keep that routine and schedule for that reason. The other suggestion I have is to seek social support. So we know that social support is a really strong predictor of better outcomes following loss. So seek out social support. It's a little unfair, but I would say that you might need to be somewhat assertive and ask for the type of support that you need. So it's just because people, I think, are often bad at knowing how to help people that are grieving. They don't know what to say. They feel uncomfortable bringing it up. So you might need to be a little assertive. You might need to say, I'd like to talk about this. And I don't need you to say X, Y, Z. I'd really love for you to just listen. Or I would like you to, excuse me, I would like you to check in with me about this periodically, because I find it helpful to talk about, but I don't want to be the one, I don't always want to be the one to kind of have to bring it up. The other thing is, as Dr. Kamkar said, you know, grief impacts everyone differently. So don't compare your grief to anybody else's. There's a lot of variation across individuals. There's even variation, you know, within individuals. Grief can be really sort of wave-like. So you might be doing okay for a while and then really suddenly be hit with it. If you're a healthcare worker, you might be still really busy treating COVID patients. You might be running on adrenaline and focusing only on, you know, whichever patient is right in front of you. So you might not have time to really grieve the losses you've experienced until, you know, down the road when things lighten up a little bit and slow down. So just know that that kind of wave-like pattern is normal. Over time, usually the waves become a little less frequent, they become a little less intense. And if they don't, and you feel really just stuck in the grief process, and it's been a really long period of time, that could be complicated grief, as Dr. Kamkar mentioned, and there are evidence-based treatment available for that if you need it.
And I think you bring up a really good point in that a lot of the times we're just so go on these front lines. People don't have an opportunity to even take a breath or to take a break. I'm curious if, I'll direct this question to Dr. Kamkar, do you have any suggestions for individuals that are now currently re-emerging back into the workforce, but also for frontline staff? What can people do to cope in the moment when they're really stressed out at work? If they just need to take a second because they're maybe spiraling or they have a lot of anxiety, what would you suggest for those individuals?
Yeah, you're right, because when we are hearing increasingly about return to work, but maybe it could be in a different type. So more businesses opening, and that has created, of course, a lot of anxiety and worries, which is very understandable. But what that means also, so first of all, with the COVID-19 pandemic, that has created for us a new normal, a new routine. As now we are hearing, and then again, working remotely, new routine. And then now we are hearing about more businesses opening. That's going to be a new routine, new normal again. As we are going to hear about, again, further businesses opening, another new routine, new normal, and so on. After vaccination, probably once again, another new normal, new routine. So we do need to accept here that we are having the series of, that's going to be the new normal. It's going to be change, but also learning from how quickly we have adjusted to that new routine that came with a little warning. Suddenly we're like, oh, new routine, new structure, everything kind of changed drastically, almost globally. And so very much learning about our psychological and personal growth, and very much our strength, because it's very much that is going to help us towards today and tomorrow. That will be another new normal, new routine. Maybe next week it might be again another new normal, new routine, this coming fall, and next week, next year, and so on. One thing again, so in addition to all the strategies we talked about, so reminding again, new routine, new structure, self-care, catching negative self-talks, putting our thoughts into perspective, and the self-compassion. But it's also around looking at our worries, because with a lot of anxiety, so it's a very normal emotion that we all go through. It's emotion, anxiety is a normal emotion. But we do know that when we add to it uncertainty, we have a tendency to also go quickly into a catastrophic theme, or something that, I'm not going to be able to cope with it. I'm going to, we feel increasingly helpless, which then again further fuels anxiety and so on. We want to capture our thought right away, especially if we then start with what if and what if. What if it's all normal questions, But that what if can quickly open the door to 1,000 of other what if questions. So we want to capture the first what if right away. And we want to distinguish our current worries with the potential worries. Current worries are, the problem and the stressors and the things that I have to deal with right now. A lot of times we want to put our time and energy into the potential one, things that might not happen, but it could be in the future, or again, might or might never happen. But it's good to being able to distinguish the current worries, the current problems, so we put our strength, resources, time, and energy into the current one. So it could be, and it's going to be different for everyone. But it can be, for some people, it's going to be working from home remotely again, maybe for the next 2 weeks, or for others, they might have to alternate between work side or home. They might have to juggle around flexibility, childcare, elder care, other responsibilities. For everyone, is going to be very different. But as much as we are able to focus on the current worries, then we are able to problem solve, and we feel kind of more empowered and seeking help, seeking resources, but very much catching a catastrophic type of thinking we might have sometimes.
So I'm hearing a really strong theme here is just kind of catching those kind of internal dialogue thoughts that might be happening that might lead to a lot of catastrophic thoughts. A fun little plug here as well. Anxiety Canada's Mindshift app has a whole segment on this where you could actually log in and help balance your own thoughts in those moments. And just redirecting back as well to those previous suggestions Dr. Kamkar was making with some of the grounding exercises at work. If you're feeling really stressed out, we have a whole section called the chill out zone where you actually get to just listen to some pre-recorded messages to help soothe you in that moment. We have a next question here. Frontline workers are faced with so many risks right now, including the constant worry of keeping their family safe when they go home. Are there any tips on how to deal with this so that the family feel safe and not stressed out every day because they have to go to work? And we could maybe start with Dr. McLean for that one.
Sorry, tips to help the family?
Yeah, so it looks like in particular, what is it that individuals can do so they aren't predisposing their family to the risk of passing on COVID, and just managing the anxiety that could come with bringing it home potentially, but also from the family's perspective, how they can manage the anxiety of knowing that they have a frontline worker in their home.
And I mean, in terms of safety procedures, not an expert in that. I know some people are literally, like I have a neighbor that they were living in an RV in their driveway so that they were not in the home at all. So I think individuals need to kind of decide what routine level of self-isolation makes sense for them given their level of exposure. One thing I think is really necessary would be an increase in communication. So if the family doesn't really know what's happening with their loved one when they're at work, what's going on with them, there's so much, kind of scary stuff happening in the news. I think a major increase in communication about what is going on at work, what things look like, could be potentially really, really helpful. I read a report from some hospitals in China that they actually had cameras in one of the break rooms or something in the hospital, so that loved ones could look and see their loved one and kind of have a sense of kind of knowing what things are like for them and see that they're okay, and that was reported to be really helpful. But barring something like that, I think just a lot more communication between the healthcare worker and their family would be helpful.
Any suggestions from you, Dr. Kamkar?
Yeah, this is a very delicate question, right? So every family will be very different, but it is important to be able to talk about it in terms of what are the concerns, what are the worries, and to come up with a plan. It's important because otherwise that can lead to more the sense of isolation and feeling despaired, and also relationship strains. So which we want to avoid all those additional stressors. So everyone has dealt with it very differently. So there are some people who, yes, as mentioned, they live like now, separately, or could be basement or in a separate place, or others and say, I'm going to take shower, I'm changing clothes, and I'm going to be with their family and so on. So everyone has dealt with it differently. But I think that here, focusing on also, I think we are also talking about possibility versus probability. Again, with anxiety, we might see the probability, saying 100% we are going to be infected, versus if we put it into perspective and we were able to reframe it, we're like, okay, they all cost benefits and so on, but at the same time, we're able to maintain a sense of safety here as well, if we're able to utilize the safety measures as best as it could be realistically and humanly possible, as others have also done as well. So it doesn't mean that, there's a health worker or a first responder who's working with COVID, that automatically it means that we are going to bring COVID home. So being able to reframe the thoughts and perspective can be very helpful in terms of managing the anxiety better. But it's also around, reminding ourselves, why am I doing this work? So also sharing that with the family. These are the positives of the work. These are the meaning of the work. And this is how much this work has helped our family and so on. And that also I need to be able to, cope with my work and to be able to do my work. And also knowing that I need my family's support. So to be able maybe to come home with whatever decision, but then also getting the family support. But I think this is a discussion around family understanding what are the positives about the work, what are the meaning of work, so that work doesn't lose its meaning. Because once again, our flight and fight response is activated. Now work is like, equals COVID, versus no, I'm going to work because I'm helping others. I love my work. I'm protecting others. And of course, financial security, house, all those financial security that also provide housing stability and all of those additional positive factors.
Thank you. Brilliant. And the healthy fear-based thinking tidbit, probability over possibility, as they say, right? And I think that's a constant reminder that a lot of us have to give ourselves, because oftentimes we get lost and we often think that it's a lot more likely or it's a lot more dangerous than it is. This next question is in particular for supporting individuals who are on the front line. There's a lot of people who know someone who's in the hospital, who is in the trenches, who is actively being face to face with the COVID virus. What would you recommend as far as supporting those individuals go? How could someone go about even start having a conversation with a frontline worker around how they could be supported? Because I imagine, that could be a pretty challenging conversation to have for some people. Maybe we could start with Dr. McLean.
Sure. So, yeah, I think people do feel uncomfortable bringing up topics that they think could be upsetting. They don't really know what to say. But I would really encourage people to try to start a conversation with those friends or loved ones that are in that situation, because we know that if you've had a traumatic experience, a morally injurious experience, having an opportunity to disclose what has happened to a supportive and trusted other, and to talk about it with them can really help that person to cognitively and emotionally process the experience. And that can give them a different or broader perspective on what has happened, and that can really facilitate their recovery. So there's a lot of potential good that can come from offering to talk to healthcare workers, other frontline workers, even if they aren't ready to talk to you. I think it's still helpful to make that offer, because it helps to know, that people care and that you have support. Again, since social support is such a strong predictor of better outcomes. Definitely don't try to force people to talk about their experiences. We know that that can be unhelpful and can actually be harmful. But I would say that it could be good to make repeated offers to talk and listen, because they might not be ready, that first time or second time that you offer, but maybe that third time they are, and it is very helpful for them.
And what's a tangible way they could actually ask that question? Like, are you ready? How could I help? Like, what would that sentence look like?
I think just literally saying, I know you've been going through some tough things at work, and I want to remind you that whenever you do feel ready, I would be happy to talk with you and listen. And just continually, making yourself available. The one sort of caveat to this would be that if you yourself have some mental health struggles, you have a trauma history, particularly if you have had experiences that are similar to those that they might need to talk about, then you could need to sort of set some limits on what you're able to listen to, or sort of provide a different type of support to them other than listening. There's other ways you can show that you care and provide support. But barring that, I would say definitely offer to talk and to listen to them. Understand that people that have had morally distressing experiences and traumatic experiences, it's very, very difficult for them to talk about those with other people. And there can be a lot of guilt, there can be a lot of shame associated with those events. So if they do decide to talk to you, they might be very, very concerned about and very focused on your reaction to what they tell you. And so for that reason, it's very important to be mindful of your reaction. Don't be overly reactive. Don't be judgmental about what you hear, and don't try to fix it. Don't try to put a positive spin on it or tell them to forget about it or try to distract them. I think the best thing that you can do is just try to be empathic and listen.
Yeah, thank you for that. And I know we've been hearing a lot about vicarious trauma as well, of these frontline workers coming home and sharing some of these stories, and people who are the listeners end up getting traumatized as well. I'm curious, Dr. Kamkar, if you have any quick suggestions as to how people could cope, in particular from protecting themselves from some of the stories that their loved ones may bring. And yeah, go for there.
Yes, and I would say that very quickly, what I would add is, in addition to everything that we have talked about, and it's always important for people to use and create their own individualized recipe. For everyone is our own individualized pathway to self-care and resiliency. So in addition to everything we talked about, I will just add boundaries. So how to set cognitive and emotional boundaries, especially whenever we are in the human service profession, it's a care profession. So yes, we do need to provide, it's a profession where we need to provide care and support and love and empathy, but it's also around how can we honor at the same time and respect our own needs and rights and wants, our own emotions as well. So for example, a boundary would be, how can we be involved without being overly involved? How can we show empathy, but at the same time honoring our own feelings and needs? And that's important, because if we start swimming here in the ocean and being overly involved, this overly sense of empathy, overly involved, this is, again, we might lose ourselves, and it could lead to that burnout and exhaustion, and then it could be the total numbness, and our body will just shut down. So how to set time for self, and how to provide this care and support, but then also I need my own time to recharge my batteries, and then knowing that I need to appreciate my hard work and accomplishment regardless of the outcome, because often outcomes we don't have full control, and sometimes outcomes, as we know, can be tragic.
Thank you. Very, very important words to live by, for sure. We're pretty much at the end of our town hall today. Thank you both so much for participating. Before we wrap up here, I'm curious if you could both share some maybe words of wisdom or any words of encouragement for both the frontline workers and first responders, in addition to the families and people who are supporting those individuals. Maybe we can start with Dr. McLean.
Sure. Well, thank you to all the frontline workers for your service. I would like to end by saying that, you know, even among these groups that are sort of higher risk for exposure and experiencing a lot of stress and potential trauma right now, know that most people will be resilient. You know, they might struggle for a time, but ultimately will be okay. And it's good to know, you know, it's good to remember that as humans, our default trajectory really is one of resilience. And that resilience is not a fixed trait. Resilience is a skill. Resilience is something that can be practiced, and it's something that can be cultivated.
Thank you. Dr. Kamkar.
So definitely a big thank you from the heart to our police, first responders, and frontline workers and health workers, absolutely. And I will just again remind everyone, appreciate who you are. Don't forget to show yourself the sense of recognition and gratitude. And I would say, please practice the self-kindness and the self-compassion every single day, because you do deserve it and you're definitely worth it. And again, a big thank you from the heart.
Thank you again both for joining us today with Anxiety Canada's Coping with COVID First Responders and Frontline Workers Town Hall. We very much appreciate your expertise and the time that you've been able to give us today. Just a quick little plug again one last time, please check out our Coping with COVID page on anxietycanada.ca. We have a whole slew of resources and articles that have been cultivated specifically for anxiety related to COVID. And also check out our app that we created called Mindshift, where we're using evidence-based tools based in CBT and mindfulness to help us cope with a lot of the stuff that we're dealing with. So thank you again both, and see you again soon.
Thank you.
See you again soon.
Thank you.
Bye-bye.
Bye.